Thanks for listening to the Elias Macko Show. We are with you until noon, and we're going to begin this hour with Aaron Derfel from the Montreal Gazette. His coverage of Quebec's healthcare system second to none, and he recently penned a piece on what's facing cancer patients in the province. Now, nearly 70,000 Quebecers are projected to be diagnosed with cancer this year. That's the highest number on record in the province. And to make matters worse, there's a backlog of over 4,500 patients waiting for their surgeries. And again, we're talking about cancer here. Let's go to Aaron Derfel. He's on the line. Aaron, welcome back to the program.
Good morning, Elias.
You know, for the longest time, when we've talked about the healthcare system on this show, we had focused on the frontline care, getting access to a family doctor, going to the emergency room, and we've seen all of those issues. But often I've said on the show, you know what, but at least when the you-know-what hits the fan, when you're faced with a serious diagnosis, it seems like the Quebec healthcare system is there for you. Your story this week, boy, it makes me believe that maybe that's no longer true. Tell our listeners here what you looked at this week.
Yeah, so it's unfortunately a perfect storm of horrible trends colliding, an aging population. But what they're seeing now, oncologists, is that they're diagnosing cases in younger people under the age of 50, and they're attributing that to a sedentary lifestyle, but they don't really know processed foods, obesity. This is a worldwide trend. So you've got older people with cancer, you've got younger people with cancer, more cases than ever. Not just an absolute number, but a number of cases per 100,000 population. So that's the incidence, and yet we don't have the resources. And during the pandemic, there were a lot of staff who were burnt out, technologists who were running the medical imaging machines who quit, anesthesiologists. There's a shortage there too. And so we should be ramping up our capacity to absorb this increase in the number of cancer cases. But we're not doing it. And then you throw in Santé Quebec into the mix. This is the government corporation that was set up in December, to run the healthcare system on a daily basis, and they're, doctors are complaining that this is a new bureaucracy. This is causing delays, and then on top of everything, Christian Dubé, you recall, ordered $1.5 billion in cuts to the healthcare system. So inevitably, this is going to trickle down, undermine clinical care. And as I said, this oncologist saying, yes, we should be getting more resources, and yet we have fewer resources than ever to deal with this crisis.
Now, on the resource front, right, you mentioned bodies, right, doctors and staff, people that are needed here. But we're also talking about equipment issues as well, aren't we? Do we have a lack of equipment here?
I don't think it's so much a lack of equipment. No. I haven't really. I think the government has made the investment, and you have private,
like medical imaging equipment. We have enough in this province.
I think we do. I think it's not. That's not the issue. The issue is getting the. Just as a personal, I had a problem with my knee, and I had to get an MRI in the public system. I had to wait I don't know if it was 3 months just to get the MRI. If I had gone public, I could have got it private. I could have got it the next day or 2 days later. Yeah. I don't think it's. I think it's mostly a personnel issue. Nobody's talked to me about a shortage in medical equipment per se.
Okay. Now, let me ask you if you believe, you were touching on Santé Quebec. Have they made things worse?
This is a trend. This is what I'm noticing. That when I was writing about the lengthy waits for heart surgery, and you had these heart surgeons who were contacting me and saying people are dying on wait lists of sudden death, suffering from massive heart attacks, and they're saying they contacted Santé Quebec, and there's a lot of turnover at Santé Quebec. Santé Quebec just recently, the head of communications lost her job, and they've announced a new position. You'll recall that there was this VP, Frederic Abergel. he lost his job. So there's a lot in a short period of time, a lot of administrative turmoil. It's a parallel bureaucracy that's been set up, and Dr. Gerald Battis, who's the head of cancer at the U.S. General, he was telling me that unprompted, he brought up Santé Quebec and saying it's causing confusion and delays. Those are his words.
Gotcha. We're with Aaron Derfel from the Montreal Gazette. We're talking about Quebecers, 4,500 Quebecers waiting for cancer surgery. Now, Aaron, I'll read you a text message from one of our listeners as we're talking here. Terry in DDO writes this. Elias, I've been fighting cancer for the past 2.5 years. I did not experience any delays for my treatment and surgeries for both ovarian cancer and breast cancer. Guess I'm one of the lucky ones. That's from Terry. Terry, keep fighting the good fight, by the way. And Aaron, I just want to get to, diving into the numbers, the number of people that are where the wait times are going past medically acceptable delays. Because there's being on the wait list for surgery, and then there's being on the wait list so long that it could impact your outcome.
Yeah, precisely. So that's what sometimes, for whatever reason, the cancer is very, the term that's used, indolent, slow-moving, and so the course of action is actually it's watchful waiting, if I can use that term. Mm-hmm. But they do track these things, and there are nearly 600 individuals who are waiting past medically acceptable delays. That means they should get their surgery within 2 months, and 2 months have gone by already, which means that their cancer is growing unchecked. And their health is at risk because of this. As you were saying earlier in your introduction, and then Terry, I'm glad that she's doing well. There are cases where, look, at all these oncologists and nurses, they're trying their best under difficult situations, and you have patients who do get good care. And there are positive, there are new treatments all the time that are better targeted, that cause fewer side effects, that are improving survival. There's a positive story to tell as well. But what we're talking about overall, when the government is keeping track of this, is a structural problem, and the latest trend, as I said, which is cause for concern, is new cancers being diagnosed in people under the age of 50 around the world, including Quebec.
So faced with that, and also obviously the aging population here, well, there's obviously a tremendous amount of weight pushing in the wrong direction on outcomes here. But do we have a pathway to making things better? Is there a pathway for Quebec to reverse this, shorten wait times and people waiting longer than is medically acceptable? Is there a path to fix this?
The government last year unveiled, I think, a 2-year cancer plan. The Quebec Cancer Foundation has complained that there really is no kind of cancer plan or cancer agency the way that there is in British Columbia. This is something that perhaps Quebec could look to. There should be more emphasis on prevention, leading healthier lifestyles, eating more nutritious food. There are still a lot of Quebecers who smoke, and so we can put the focus more on prevention. That would be the pathway. And there are nations around the world that have where people live longer and are more functional, and we can learn from those societies. So there are solutions, and some of them are not necessarily costly. But for whatever reason, in North America, we like highly processed foods. And some people don't like to get out on their bike, or they don't like to get out on their treadmill, and we should be involved in more physical activity. So that is a pathway, and there are new treatments. Artificial intelligence, we'll see what that does. There's some hope that it can help out. So it's not all gloom and doom, but certainly the worrisome trend is more cancer cases in younger people than ever before.
I'll tell you, Aaron, I had a colonoscopy a couple of weeks ago, and everything checked out, by the way. Everything's great. But they also asked me if I would sign a waiver so that they could use the footage and all of that to train AI for detection. Wow. So, I mean, they are using that. Aaron, since you published your story, Have people been reaching out to you with their stories? Have you?
Yes,
Yeah.
yes. Some cases, I don't want to go into too many details, but people have been reaching out and talking about their stories. Unlike the listener who texted you, mostly negative stories, people having difficulty accessing the system, getting their surgery done, and when you're talking about, like, it starts with you see your family doctor. If it's hard to even have a family doctor, then how could you get a referral to see an oncologist?
Uh-huh.
So even before you get to the wait times for, in a sense, the wait times are like the tip of the iceberg, because there are delays in getting access to specialists and delays getting family doctors. That's why people are showing up in emergency rooms. This is why the government is trying to boost productivity with Bill 106. Not that I'm saying this is the greatest reform ever, but you can see why the government is concerned and wants to do something about it. I really think that Christian Dubé is acting in good faith. He genuinely wants to improve the system. He sees that there are problems, but there are a lot of variables. Healthcare is inherently complex and unpredictable, and it's very expensive. We're spending $65.5 billion a year. No, I think it was $55 billion a year on healthcare. So, the cost is rising, and the government has to balance various interests, including it doesn't want to raise taxes too high. Already, we pay, I believe, the highest taxes in the country, in North America.
In the country, yeah, that's right.
And housing prices are skyrocketing. So you have to balance all of these things, and it's just a ticking time bomb demographically with the baby boomers, and then something that no one could have expected, this kind of black swan incident of younger people who are learning that they have cancer. And, the worst timing with the pandemic, putting the healthcare system under tremendous pressure for a few years. And we're still kind of feeling the repercussions of this. I think that, if I had to give a prediction, I would say that the system is we'll see things get worse before they get better. But I am hopeful that things will get better. In 2003, I wrote a series called The New War on Cancer about these new biological cancer therapies. And it used to be, with cancer, that it was an automatic death sentence.
That's right. That's right. Aaron,
yeah.
Listen, I have to leave it there. I got to get to traffic here. But you're right. Like there is this story in healthcare, right, where we are coming up with new treatments. We'll leave it there on that positive note to end things off. Aaron, thanks so much.
My pleasure.
I'm Dylan Playfair.
And I'm Tyler Smith.
We're putting loneliness in the penalty box by talking to some of our favorite athletes about the importance of friendship.
This is Bromance.
Bromance is brought to you by Charm Diamond Centers, proudly Canadian-owned and operated. Charm has been part of your love stories and bromances for over 50 years. And you can find Bromance on the iHeartRadio network or wherever you get your podcasts.